bone that implants can be placed. But this is a patient that wears a denture.
Now, okay, so this gentleman would normally put a denture on, and without
Right.
implants, because there's no activity on the bone or in the bone per se, it's kind of like a muscle. It starts to atrophy, right? It
Absolutely.
starts to shrink. The second photo, this is a picture of, it's still got the little swoop in the front, but I notice now that it's very thin, it's almost gone. What is this?
That's what happens to the jaw with the denture in for 20, 30 years. This is what happens to the bone.
Now, there's a little nerve that runs along that bone, is there not?
Actually, the nerve is in the middle of the bone, right in this
The
area.
little dark spots we see running down the middle of the bone, that's the nerve. Wouldn't a denture writing on that feel?
Absolutely. As a matter of fact, I just found out a very interesting statistic that in a rest home where there are old people that have dentures, 25% of the patients wear their dentures.
The other 75
don't. Why?
They're painful.
Because it hurts. Because they look like this.
Because they waited.
Right.
And at this point, okay. With that said, let's get into talking about sleep disorders, sleep apnea. Just to start, what are some of the biggest signs that somebody should look for before we talk about the cures to maybe find out if they have sleep apnea or they have some sort of sleep disorder?
Well, the first thing that is dangerous, of course, would be falling asleep at the wheel when you're driving.
So if you're tired during the day?
Tired during the day. People that have heart conditions also have sleep apnea.
Now tell me what you said to me about that. You told me that cardiologists...
Well, it turns out that 50% of patients that go to heart specialists have sleep apnea. That means that 50% of the patients that have heart conditions, that are diagnosed with heart conditions, have sleep apnea.
Okay, now what about like snoring? Or you told me the bruise in the ribs.
Well, that comes from the spouse. When people have sleep apnea, they make a lot of noise and hold their breath, and there's a lot of activity that's occurring for the bed part or at nighttime.
And basically what happens is they quit breathing.
Yeah, they quit breathing.
It's not that they mean to hold their breath, they just stop.
They just stop breathing, and then they wake up again. At that point, it scares their spouse, and their spouse says, "Quit that, wake up, breathe."
All right, Doc, I know you brought a video clip to kind of show or explain what sleep apnea is. Now, this is the worst. This affects 10% of the people with sleeping disorders. But let's watch the video real quick and kind of tell me what's going on.
And notice how she held her breath right there, and then she gasped for breath. What's happening there is her tongue collapsed against the back of her throat to cut off the airway space. When you reach a certain level or a certain stage in sleep, your body becomes paralyzed and your muscles collapse.
You just quit breathing.
You quit breathing.
And your body wakes you up to say, hey,
yeah,
we're getting ready to die here? Or
yeah, exactly right. Well, the body's saying, breathe, please.
Now, do they know?
We need oxygen.
Do they know they quit breathing?
Mostly
Does the
not.
patient know?
No, mostly not.
Now,
the only way they will know is if their spouse lets them know and they have a little black and blue spot on
or if they live by themselves, they're tired, listless, worn out all the time.
Driving into things because they fall asleep at the wheel, all kinds of things. Have heart conditions.
Now, you explain the heart conditions. Explain to me a little bit, and I know apnea is the worst. Apnea is where they actually quit breathing during the night.
Yes.
We're going to talk a little about the treatments and the diagnosis of it. But explain to me a little bit about what the lack of oxygen during the night does to your body. You talked to me about getting into REM sleep. Give me a little detail.
Well, in order for our body to rejuvenate, the juices to allow us to continue to live, we need sleep. And the most important part of sleep, the stage called REM, which is rapid eye movement. During this period, that's when the, if you will, rejuvenation juices are released. For adults, it's nitric oxide, which allows the heart to clean itself out, if you will. For children, it's the growth hormone. So children that have this condition don't grow. They have ADD. They have all kinds of problems.
See, this is something that you brought up to me that I was really... So was a child small, maybe undersized, you said maybe continues to wet the bed, maybe a little hyperactive, may mean they're not sleeping well?
Absolutely. Not only not sleeping well, not getting enough oxygen to their system to be able to grow properly and to develop the way they're supposed to develop. Most of the time, the cause of this, tonsils. Tonsils are huge, the adenoids are huge, they just can't get enough air during the nighttime because at that REM sleep, all these tissues collapse, they can't breathe, then they wake up gasping, they just never stay in that REM stage of sleep to allow them to do what they need to do.
All right, now you brought a picture real quick, just so that people can see the difference in what the back of the throat is. So if you're a parent, you have a child that's undersized, maybe still wets the bed, doesn't pay attention, you know, all those things. Can you just open up their mouth and look in and see if maybe you need to go get them checked?
And say, ah. If they say, ah, and you look inside and you don't see any
So
opening.
class 1's what you're looking for.
That's right.
And
And if you see big bowling balls in the back of the throat called tonsils, and you don't see much of a space there, that means that when they're asleep, that space totally closes up, and that's why they don't breathe at nighttime. That's why they don't grow, because the growth hormones are developed
here's the
there.
reason I asked, because obviously all of this sounds like something I would take my child, or I would go see a doctor for, a medical doctor for, not a dental doctor. But you're a dentist, and you deal with this and treat this all the time. Is this something that for some reason isn't really paid much attention to in the medical community?
Well, here's the deal. Dentists have the opportunity to see their patients once every 6 months, or every 3 months or 4 months, depending when the recall is, or continuing care, we call it in our office. And in my office, we check for all these things for adults and for children. We check for their airway, we check their blood pressure, we do all these things routinely because we are their first line of protection for their health. That's the way we see it in our office. We do cancer checks, we do all kinds of things
Now,
when they come in for their continuing care. This is part of it.
Prior to January '06, it's my understanding that this was purely considered a medical issue. You had to go get the standard, the CPAP machine that we're going to get into. But as of January '06, oral appliances are actually the preferred form of treatment now, aren't they?
Well, according to the American Academy of Sleep Medicine, the primary treatment for moderate to mild sleep apnea are oral appliances.
Okay, we're going to
Prior, it was CPAP.
All right, we're going to get into that. We have to take another quick break. When we come back, we're going to get into the diagnosis and the treatments that are now available for sleep apnea. We're in studio with Dr. Langstaff. We'll be right back.
What is a hero? Are heroes born, or are they made? In after-school programs, your kids will uncover hidden strengths, discover they have the power to change their future, and find the hero inside themselves. Let us know you on after-school programs in your area. Call 1-800-USA-LEARN. After-school programs, helping kids find the hero within.
Welcome back. We're in studio with Dr. Langstaff discussing sleep disorders. All right, before we went to break, we were talking about sleep apnea, what it is, how it's caused, and another thing. Until recently, the treatment for sleep apnea, or the way to diagnose it, has always been to go to get a sleep study. Is that not correct?
Right. Polysomnograph.
Polysomnograph. Now that says, I'm going to bring up a picture real quick. This looks like a young gentleman having a polysomnograph. Is this about what it looks like? They wire you up in the hospital?
Pretty much in a sleep lab. They try to make it as comfortable as possible, but it's a sleep lab. So it's a room with a bed and with the wires.
And they're watching you while you try to get a normal night's sleep.
Yes.
Yeah, and in this picture, I just want to show real quick, because this gentleman, I don't know how he fell asleep, but you can see they have a CPAP next to him, and you said that that's a study they do
A split study. Yeah.
half and half.
Right. So they'll do half the night with regular.
But what are the odds you're going to sleep like you normally sleep? I mean, I don't sleep as well in the hotel as I do. What are the odds if you go to a hotel room?
Well, apparently, according to the research, you really don't sleep as well in a strange bed the first night. The second night you do, but not the first night. So
And these are done the first night?
Yes.
You go in. All right. I go in. I have a sleep study done. I'm diagnosed with sleep apnea. Up until recently, if I'm not mistaken, this is what I would get. This is a constant pressure airflow CPAP machine.
CPAP, constant pressure airflow.
And this is the way it was treated.
Yes, still is. I mean, this is a CPAP mask that's hooked up to a hose that will go to
And
a
it just-
machine
it-
that pushes the
All right,
air pressure
I have
in.
friends that have it, which is part of the reason I brought you in today. I have friends that have this, whose lives depend on them wearing it, who don't wear it. Because they say it's cumbersome, it doesn't, it's hard to, the noise, it makes...
Well, none of that. People